Today we will be looking at the anxiety disorders, or as it was earlier called, anxiety neurosis. The term neurosis actually refers to the whole gambit of minor mental health disorders and is now not a preferred term. But neurosis was a term that was used for a long time, and according to some people like Sigmund Freud and so on, this kind of neurotic disturbance underlies most of the minor mental health disorders, whether it be obsessive compulsive disorder or the phobias and so on. So the term neurosis still sticks to some extent. Now, when we now move into the minor mental health disorders, there is a problem between differentiating normal and pathological. Many of these reactions and symptoms can also occur in normal people under stressful conditions, when they are under threat, but they respond appropriately. Even their performance may be enhanced, as I will show, when they have a anxiety component. When it becomes dysfunctional, when it starts interfering with their function or they feel distressed, then we may call it a disorder. It becomes pathological. So always we have to remember that there is always this need to differentiate between normal and abnormal. So anxiety neurosis is a disorder. It is where it is interfering with normal function to an extent that it is incapacitating, or the person is not able to achieve optimal levels of functioning. But anxiety itself is a normal and universal emotion provoked by a threatening stimuli or a stressful situation. It is biologically adaptive and protects the organism against a potential harm by drawing attention to an oncoming danger. So the organism becomes alerted, ready to face, and the physiological response helps them to respond, the beating of the heart, the increased blood flow, and so on, as we will describe. It is like pain in physical, normal physiological terms. It's like pain alerting a person that there is some noxious stimuli. It promotes a state of arousal and gears the organism to face the threat by either flight or fighting against it. And nowadays they also describe freezing. Some organisms are so incapacitated sometimes, if the anxiety becomes pathological and extreme, person may actually freeze. So to understand this concept of biological adaptation or adaptive response, we look at how it is actually physiologically, in physiological terms, to understand what happens. And generally, when there is a threat, the person's autonomic nervous system is activated. And there is a, as you would remember from your physiology, various responses in the different organ systems due to the activation of the sympathetic nervous system, the branch that is involved in emergency responses, including activation of the adrenal medulla, so that adrenaline and noradrenaline is secreted, which enhances all these other responses. We look at this in more detail in the next slide, but like increased beating of the heart, dilatation of the pupils, reduced saliva, the muscles become tense so that they contract faster and in a stronger way, and they are reduced functioning in the GI tract, which is not needed, so that there is reduced peristalsis and so on, breakdown of glucose, that's necessary for metabolism. So all these changes help the organism face the threat. Now if you look at it a little more in detail, generally we are saying that the anxiety response is more to do with the sympathetic nervous system rather than the parasympathetic. The sympathetic nervous system causes these changes in the different organs, and these are important because we can understand the pathological anxiety as an excessive activation. So all these symptoms will be there. These are all characteristic of anxiety disorder. Dilatation of the pupil, dryness of the mouth, increased heart rate, increased respiratory system. As the respiratory system starts functioning in an increased way, the bowels may not function. But paradoxically, in some people, rather than sympathetic activation in some other organs, you may get a paradoxical stimulation of the parasympathetic system may be activated. So some people who are having anxiety symptoms may have increased bowel movements. Similarly with the bladder, they may have increased micturition and so on. So it's not always that this is a sympathetic system that is being stimulated. Sometimes you can get other organs. The liver and the adrenal medulla also respond. There is increased breakdown of glucose which is needed for the metabolism, and the adrenal medulla secretes adrenaline and noradrenaline into the blood, that all these reactions are enhanced. And when a person experiences these changes, particularly the increased heart rate and the increased working of the heart, the respiratory system, sometimes the bladder and so on, abdominal changes, they are cerebral. They are able to perceive these changes, and this increases the anxiety. So you get a cerebral, the cognitive element, they perceive the increased activation, and the anxiety becomes increased. So you get a kind of vicious cycle of increasing anxiety, and all the symptoms are increased, and they perceive the heart beating fast, the tenseness in the muscle and so on, and the anxiety may increase. So sometimes we use drugs to break this cycle. Like for example, we can use beta blockers, propranolol, to reduce the heart rate, and that will break the cycle, and the anxiety may settle by less, the heart rate becoming less obvious. Now that was more the somatic, the physiological changes. At the same time, in anxiety you get cognitive changes. The brain itself is involved, and the system that is most involved in most emotional disorders is the limbic system, the limbic lobe. So usually the limbic lobe is the medial structures in the depth of the brain, particularly amygdala, nucleus amygdala, and some other structures are surrounding that. But all these have neuronal pathways connecting them to the cerebrum, to the basal ganglia, to the thalamus, and so on, as we will see in the future slides. And so the whole cerebrum may respond with anxiety, but the limbic lobe is particularly important in the perception and in the emotions that are manifested. Now, looking a little more detailed at the amygdala. Amygdala is somewhat key in this whole process, particularly with a lot of emotional disorders, including anxiety. And they say that experience of fear is fundamental to anxiety. The panic and phobias is due to amygdala functioning or dysfunctioning. While some of the cognitive changes like worry, apprehension, some of the obsessions are due to pathways that connect the cortex with the striatal nuclei, the thalamus, which again go back to the cortex and so on. So you get a kind of sometimes called reverberating circuits from the base of the brain or the limbic lobe to the cortex and back. So looking at some of these circuits in more detail, when we look at the amygdaloid nucleus, it is connected to many other structures in the brain. So to the cortex, to the orbital prefrontal cortex, it's an older part of the brain, very much involved in emotional perceptions, brain stem sites, particularly for stimulating the sympathetic nervous system. So these are located in the locus coeruleus. So when you get impulses from the amygdala to the locus coeruleus, that may activate the autonomic nervous system. Hippocampus may feed back memories, so that once a person has experienced a traumatic event, a fear-provoking situation, that will again stimulate this whole response by just seeing it or even hearing about it. So as I was mentioning, we can look at anxiety as a normal response, and this is usually divided into the cognitive part and the physiological, the lower part of the body, the responses in the physiological system. So generally they say that you can see that when a person is anxious in a threatening situation, the attention is narrowed so that they can focus on what is threatening. So these are all adaptive. This helps the organism to meet the threat. There is hyper alertness, concentration is increased with vigilance and scanning. Physiologically, as we mentioned, as we looked at the previous slide, the autonomic nervous system stimulates the adrenal medulla so that more adrenaline and noradrenaline is pumped into the blood. The heart rate increases, it contracts more forcefully, inotropic action. The non-essential blood vessels are constricted, so you get a coldness in the extremities. Some vessels to the heart and muscles may be dilated because they are needed in emergency. So there is a kind of a differential action on different parts of the body. The organs that are needed for the emergency, you get more blood flow. Respiratory system is stimulated so that more oxygen comes in. Liver, glucose is released for energy. The muscles contract better because the gamma afferent system is stimulated. The contraction speed and tone is increased, and eyes may be dilated, and sweating to help with this loss of heat. So you can see all these responses are adaptive. They are helping the organism meet the threat. And we can see this in this following graph, where it shows that as a person becomes anxious, their performance increases. So you can see the level of performance on this axis, the y-axis, and you can take any parameter that you can use in anxiety to measure. So usually we use the pulse rate because the heart starts beating fast, but you can take the respiratory rate or the tenseness in the muscle and so on. So normal resting pulse is around 70, and as a fearful or threatening situation is presented to the person, pulse rate may go up. And as the pulse goes above a certain, say 80 or thereabout, their level of functioning, the bodily function starts improving. Because as the heart pumps more blood, more oxygen gets distributed, more glucose, and the muscles are able to perform better, quicker, faster, stronger, and so on. So the performance level increases until you get some kind of optimum level of functioning, which may be around 100 pulse rate, 110. And then once if it becomes more than that, then the performance starts falling. So, we may say that this side of it is pathological, morbid anxiety, anxiety disorder, while this may be normal anxiety helping the organism is a biologically adaptive response. So, now we are looking at the pathology, the abnormal, the morbid side. So, anxiety disorder, and these are characterized by, as we would expect, a persisting response. So, the heart rate is it keeps on pumping hard even after the threatening stimuli is gone or without any cause, and it is excessive. And there is severe autonomic disturbance with sympathetic overactivity, somatic symptoms, tenseness in the muscle, neck pain, chest discomfort, abdominal changes, butterfly in the stomach, and so on, and worry. Again, this is a characteristic of the reverberating circuits. Again and again they are thinking about the same issue, ruminating, and so on. That is characteristic of anxiety. So, some features to help, because this sometimes is a clinical problem. Is this normal or is this morbid? Do we need to treat, or do we reassure the person and say that this is you will get over it, it's normal, and so on. So, one is of course the morbid, the abnormal is excessive and prolonged. There is impairment in functioning. So, rather than optimum level of functioning, the level of functioning deteriorates and the person may become more and more incapacitated. At one stage there may be freezing, person may not be able to function at all. So, disturbed capacity to work, their relationships may deteriorate, he may be not able to relate to others, he may avoid others, avoid responsibilities, and there may be objectless, without any threat the person may show anxiety response. So, these are some features that may help you to diagnose anxiety disorder. Now, the epidemiology of anxiety, it's a very common condition, affecting in a year maybe 15% of the population, and over lifetime so maybe 20% of the population. Very common condition, very often not recognized, not treated, taken as part of normal. Person learns to adapt and live with anxiety. Some take to other means like alcohol and so on to reduce anxiety, but it's very prevalent. Certain forms of anxiety, which we will come to later, have much lower prevalence for that specific, for example, the phobias or panic disorder. They find that general anxiety disorders are more common in adults, while phobias are more common in children. Females seem to outnumber males in most anxiety conditions. Some, there may be a gender balance. Some people show a kind of chronic course, so that lifelong anxiety remains a problem. Some may show an episodic, so that when they are faced with threat or stressful situation, they may become anxious, but otherwise get over it. Anxiety is, as I mentioned at the start, very often associated, or it is part of with other minor mental health disorders, particularly depression. Maybe up to 80% of people may have both depression and anxiety combined in different proportion, as we will discuss later. It is commonly found with various substance misuse, particularly alcoholism, and alcoholism may be secondary. Person who is anxious may learn to use alcohol as an anxiolytic, one of the best anxiolytics known to man, and the alcohol may be initially started as a form of self-medication. Certain medical conditions seem to be associated with anxiety, which can aggravate or exaggerate some of the medical conditions like asthma, various cardiovascular conditions, respiratory system, hyperventilation and so on, and gastrointestinal well known is irritable bowel syndrome. So, anxiety seems to be, and sometimes treatment of the anxiety component improves the medical condition, and their need for medication and so on may become much less. Certain endocrinal disorders like hyperthyroidism, and very difficult to distinguish hyperthyroidism with anxiety. We will come to that a little later. Certain diabetes, people with diabetes, sometimes we can see in their history or in their even the clinical current clinical syndromes, very important component is anxiety, stress and so on, and migraine. Now, looking at the economic, the cost of anxiety, how much it interferes with a person's work, his output, his productivity, they find that generalized anxiety disorder, the loss of working days is very high, higher than most other conditions. Major depressive disorder, various vascular disorders, arthritis, asthma, diabetes, leads all of them by the number of days of impairment in a month. Now, as in other psychiatric disorders, there is evidence for both the genetic and hereditary component or in the etiology. It may vary, but the minor mental health disorders general are said to be more due to environmental causes, or environmental causes have a higher impact, but there is a genetic basis, there is a familial history often, and sometimes you might find that other members of the family also have anxious symptoms, anxiety related complaints. Some have argued this is because of a person growing up in an environment where the parents or one parent may be anxious, may learn that kind of responsive style, adaptive style, and it may be learned because of being in that environment. Other anxiety conditions also, there may be a genetic factor. You might find that even from in a newborn, some newborns show a hyper beta adrenoreceptor response, so that if you make a loud noise, their heart rate suddenly you can see increases markedly compared to other babies. So their beta adrenoreceptors may be more sensitive and more reactive. Certain personality types have been well known to predispose to anxiety, and there is a personality type described as neurotic personality, a very highly strung, sensitive, who get upset by small incidents and become fearful or apprehensive when something novel or new is about to happen, or they anticipate. So this is supposed to be characterized as a kind of a neurotic personality. So we have this concept, trait anxiety, that is a person who is always anxious, who is a warrior, who has this kind of neurotic personality, very sensitive, easily disturbed by minor problems, issues, and tends to worry all the time. While some seem to be stable, but if there is a particularly stressful life situation or an event, they may react little excessively. So that is called a state anxiety. That is only for the time, for a period, and once that stress or that threat is removed, person may return to normal level of functioning. Now, continuing with the etiological considerations, there is considerable theories about the cause, and a famous father of psychoanalysis, Sigmund Freud, had a lot to say about possible causes, and they usually trace the beginning, origin of neurosis to childhood experiences, to childhood events, and to the environment as a child. And the child's early experiences may become fixed, may become memories that can trigger anxiety later in life, or they become a kind of a learned responsive style that they repeat later when they are adults or when they are faced with threat and so on. So very often these theories go back into the childhood and sometimes identify events that have happened that may be the cause of their current condition. It's particularly true for phobias, where it is very clearly you can see that somewhere as a child they may have experienced excessive fear or have been faced with a threatening situation related to some object that may not cause anxiety in others, but because of the childhood experience, even as adults, if they see, say, a dog or a cat or a rabbit, which are innocuous in themselves, they may become very anxious because they have a phobia, excessive fear. So these are some of the theories, psychoanalytic and behavioral. Behavioral is mainly they are saying that it's a learned maladaptive lifestyle. They respond to a problem because that seems to have helped them in the past. There's a reduction in the anxiety. So they avoid those kind of situations, and that causes relief of the anxiety. And they learn to always respond to stress by avoidance. But that doesn't solve the problem, and it may cause more anxiety at the end. Now, looking at the clinical features, there are different ways of understanding the clinical features, as I took some time in the beginning to show you the physiology and how the different organ systems respond in normal anxiety. That helps us to understand some of the symptoms we see in anxiety disorder. It's just an excessive. It's a sometimes what we say is a quantitative difference from normal, and a little more severe than normal. And similarly, we can differentiate the two components. Although in a person it happens together, we can say cognitive component and somatic component. So looking at the cognitive component, which is the brain-based due to the symptoms in the mind, you can look at the excessive fear that is almost the fundamental problem in anxiety, which is characterized by apprehension, dread, foreboding, that something dreadful is going to happen. Then also worries, the person always worrying, looking at the possible consequences, looking at the worst side or how difficult it is going to be, and this kind of repetitive thinking about the same problem issue, what we call rumination, thinking too much. Also, you might find that there is increased vigilance and scanning, which is part of the early biological adaptive response, so that their attention is focused, but this may continue, so that they are always in a hyper-aroused state. A small sound, small disturbance makes them react. So you can get a what you call like a startle reaction. They may jump when there's a sound. Very often there's insomnia. They find difficulty falling asleep, or once they fall asleep, they get up frequently and then toss and turn in bed. When they get up in the morning, they feel tired. So these are characteristic of anxiety. They may get nightmares and feeling of tension, keyed up, on edge, irritability, all characteristic of the cognitive aspects of anxiety. So this is in picture form taken from Stahl, and these are the common symptoms that we have been talking about in the brain. in the mind. And some symptoms, they feel the tension in the muscles, sleep problems, concentration, and so on. Now, looking at the somatic aspect, and this is easy to understand if we follow the physiology. Right, in the earlier slides, I took some time to go through the changes in the different organ systems, and we can again look at it based on the organs. So, due to the autonomic hyperactivity, you get changes in the cardiovascular system, the increased beating of the heart, palpitation, and so on, sweating, increased breathing, sometimes called hyperventilation syndrome, gastrointestinal changes, sometimes irritable bowel syndrome like symptoms, lump in the throat, dry mouth, increased frequency of micturition, and the musculoskeletal system, tension in the muscles. So, very often persons have pains and aches all over the body due to the continuing tension, particularly in the neck muscles or in the head region, headaches and so on. And on physical examination, very characteristically, you will find that the person is unable to sit still, they are fidgety, pupils may be dilated, some of them wear dark glasses to keep the light out of the eyes, they are very distractible, they may have tachycardia, pulse rate is high, and there may be tremor and sweating, but the hands are cold and clammy because of the peripheral vasoconstriction. Another way that we can understand anxiety and also some of the subcategories is to look at the temporal pattern. So, sometimes anxiety can be just only for a period, for a short duration, and that may be few minutes to maybe an hour, or usually doesn't last more than an hour, where the anxiety can become very severe. Person may feel that they are going to die, that they are unable to breathe, they are going to choke, that something terrible is going to happen, and that is sometimes called panic. And they may get several episodes in a day or over the week, and then in between they may be quite all right, and this panic may be precipitated without any apparent cause. So, we have a condition called panic disorder, and there is a association between panic disorder and agoraphobia. Some people have such frequent panic episodes that they stop going out because of the fear that they may get an attack while they are out, that they may collapse, they may faint, so they stay in their homes, they are afraid of crowded places, and this is called panic with agoraphobia. You can get subacute reactions where it may last for a period. These are usually what we call state anxiety. Suppose there is an exam coming or an interview, say a marriage situation, anything that is the person finds stressful, they may be anxious over that period. And then there is the chronic anxiety. This is the generalized anxiety disorder where there is a persistent foreboding, persistent feeling of anxiety, worries, that is sometimes called free floating. Without any apparent reason, the person is all the time anxious. Then another way of looking at the clinical picture is looking at stimulus specificity and non-specific. So, when you say stimulus specific, it is related to some specific object or situation. So, if it is related to a particular object, we call it phobia, and the anxiety is provoked by certain animals or insects or blood. These are particularly common in young children or in females, and it is disproportionate to the stimulus. So, normal people may not experience such degree of anxiety. It is involuntary, it cannot be explained away, and usually leads to avoidance because the person avoids these objects. So, phobias and generalized situational. For example, agoraphobia we already mentioned. fear of open places, markets and crowds and so on, and they may become housebound. They are afraid to leave the house, and it may be associated with panic. Social phobia, social anxiety disorder is another common condition where people become anxious where there are social gatherings or social situations like eating in public or speaking in public and so on. Then there are so many other types of phobias which we may not go into too many details, but you may come across in your clinical practice. Mysophobia, hydrophobias, acrophobias and so on. Particularly important from a medical clinical point of view is some anxiety related to heart conditions. They are sometimes called cardiac neurosis. And now, because of the wide prevalence of AIDS, people have developed AIDS phobia. Then there is a non-specific anxiety, which I already mentioned, where the anxiety is free-floating. There is no specific object. They are all the time anxious, all the time worrying. They create situations almost, imagine. So they are all the time apprehensive of what's going to happen. Now, the phobias we mentioned specific to some objects or situations, and the different phobias we can look at the demography and the prevalence and so on, and we have outlined it in this table. I will not go into too much detail, just to point out like agoraphobia, there may be more females affected, it starts in early adult life, and it can present with or without panic. A social anxiety disorder usually common in adolescents during their identity formation times when they are very sensitive to peer pressure. They may feel that others are critical, humiliating, looking at them in a negative way and so on. Phobias are common in childhood, particularly of animals and insects, blood phobias. So there are so many different types of phobias, and to a large extent it depends on their childhood experiences. And there is very good treatment, various ways of gradually desensitizing them to the feared object. So now we come to the differential diagnosis, and as I mentioned, one of the difficult conditions to distinguish is hyperthyroidism. When you get a thyrotoxic person, when there is increased functioning of the thyroid, it may cause a lot of the symptoms very similar to anxiety. But there are some differentiating points. In anxiety, that is not in thyrotoxicosis, there may be a psychological cause. So you might be able to identify a stress factor, or the situation may be very threatening. There may be a pre-morbid neurotic personality. And on examination, in an anxious person, you might get cold and clammy extremities. There may be weight loss and anorexia. In anxiety, in hypothyroidism, you may get a weight loss, but there may be increased appetite. A sleeping pulse is normal in anxiety. And beat lag you may find in both. Then cardiac conditions, paroxysmal atrial tachycardia, mitral valve prolapse has been mentioned, and anxiety may be commonly found with other psychiatric disorders, particularly depression. And there it may be important to establish which is primary, so that the treatment can be focused more on the primary condition. But very often they are mixed together, and you get a condition called mixed anxiety depression, and MAD, where both anxiety and depression are present at the same time. So the importance of looking at the mixed picture, very of the symptoms are overlap and very similar in major depressive disorder and in anxiety. There are some similarities and some differences, and sometimes it's very difficult to differentiate, and sometimes you have to treat both. Then the management, how do we manage anxiety? There is no, the goal is not to fully treat in the sense of the person completely recovers, although in state anxiety, once the stress and the threat is removed, the person may become fairly normal. Generally, the line of approach is to manage anxiety. And of course, as doctors, we like to use drugs, and the common drugs, the first line drugs are usually the SSRIs, and most of the SSRIs are very useful. Paroxetine, sertraline, fluoxetine, and so on. Fluoxetine, unfortunately, at the initial stages may cause some anxiety, and we may need to warn the patient about that. The SNRIs, venlafaxine and Pristiq, are particularly effective for anxious symptoms, and drugs that have sedative profile like mirtazapine is particularly useful for anxiety. Then the tricyclics like amitriptyline, which has a sedative effect, very useful for anxiety, and it may help with the sleep also. So it's an anxiolytic in a way, amitriptyline. Clomipramine, imipramine, clomipramine particularly if there is OCD symptoms. Benzodiazepines are very useful, one of the best anxiolytics, but unfortunately because of the abuse potential and dependence, we have to be very careful. But for short term, for episodic use, like for PRN or SOS, when they are facing some difficult situation, you can use the short acting variety like midazolam, lorazepam. Alprazolam is particularly useful for conditions like panic disorder, very powerful, very well known to cause dependence, but very effective. For chronic long-term anxiety management, some people use long-acting benzodiazepines like diazepam or chlordiazepoxide. Monoamine oxidase inhibitors have a place as a second line, or for conditions phobic anxiety and so on, it may be the treatment of choice. Some of the newer anticonvulsants like pregabalin and gabapentin have a action on the GABA receptors, and they have been used now, and they are being promoted for the use with anxiety. Antipsychotics like quetiapine have been promoted for use with anxiety, particularly in very low dose. Then there is a role for using drugs that act peripherally. As I mentioned, to break the cycle, you use drugs like the beta blockers to break the feedback from say increased heart rate or the tremors and so on. And ECT is usually contraindicated anxiety, it increases anxiety. So quickly just looking at how the various drugs may work, the serotonergic agents, the SSRIs and so on, seem to work by neutralizing the excessive activation that you get through the amygdala. So they work through the, say from the median raphe, you can get serotonin neurons, which then neutralize the excessive activation, and the person may then experience a relief of anxiety symptoms. Similarly, the GABA, the drugs that work on the GABA system, they seem to be analogs to GABA, or they have particular receptors. For example, the benzodiazepines, they have benzodiazepine receptors, which enhance the GABA system. That the GABA neurons are usually inhibitory, and they inhibit the excessive activation. So you might find that using the GABA, activating the GABA neurons again reduces anxiety. Now, benzodiazepines is a well-known anxiolytic and used widely. So we just take a little time to look at how the benzodiazepines work. They have special receptors very close to the GABA receptor, and by occupying the benzodiazepine receptor, they may enhance GABA function by increasing the, say, the chlorine channels, which causes hyperpolarization and can inhibit the hyperactive neuron. So, by increasing the inhibition, they can normalize the neuronal transmission. The ones that have been hyperactive can become now neutralized. Now, in addition to drugs, the drugs are only short term. You have to actually manage the anxiety over the long term by using various psychological means. And they have used psychotherapy, using various psychoanalytic techniques to explore the childhood, what has happened to the person in the past, and try to bring that into consciousness so that the person is able to face what happened, and through that achieve catharsis or achieve recovery. Now, much more useful in the modern context, used much more often, is what we call cognitive behavior therapies. Based on the type of anxiety and the situation, different behavior therapies and cognitive therapies are in use. They are mainly aimed at deconditioning. So, the theory is that is due to some faulty conditioning or association in childhood, the person may develop anxious response to certain situations or objects. So, you decondition, particularly systematic desensitization. So, well known technique that is very effective. And this can be done in fantasy also. The person may not need to be exposed to the actual object or stimuli. And some people can be encouraged to meet up to face the situation that is threatening with the support, with sometimes they can be taught relaxation exercises, so they learn to relax, and so they learn to not avoid the situation, they learn to face up to it and gradually gain some mastery. You can also use social skills training in social anxiety so that people learn how to interact with others, to speak in public, how to behave in a socially acceptable way. So, generally all these types of different treatments can be used in a as a package, what we call anxiety management training. Particularly they may be taught from the cognitive point of view to reframe events that they took as threatening, to analyze and look at it in a slightly less threatening way. Very much part of the whole management is teaching the person relaxation exercises, because very often the person responds to perceived threat by becoming very tensed, hyper aroused, the muscles become extremely rigid, the heart starts beating fast, the respiration becomes very rapid and shallow. So, by teaching them relaxation techniques, we can counter this and achieve a state of calm and tranquil mind. And various methods have been used: breathing exercises, muscular relaxation, transcendental meditation, and biofeedback. And I will come back to this little later on. But fundamentally what we are trying to do through relaxation is to break this cycle of worries, tense muscle, causing various somatic complaints like pain in the neck and headache and so on, so that this kind of vicious cycle is broken by using relaxation. Now, in our setting here, we have done some research into using various relaxation techniques, and we have found that there is a lot of similarities between the Western techniques and some of our traditional practices. And some of the Western techniques that have been used, like progressive muscular relaxation, is very similar to some of the yoga methods like Shanti-asana. Some of the biofeedback again is very similar to the mindfulness techniques. Transcendental meditation is very similar to the repetition of mantra that we use, and so on. So the relaxation methods that we have been using here, we have researched, we have published papers on the effectiveness, and even medical students have done research for their third MBBS research project on using these techniques for not only psychiatric problems but even for medical conditions like hypertension, asthma, as I will mention. So what are the techniques that we use here? One is the repetition of words. So in the Hindu system, that is called japa, and you can repeat mantra uchchadana, repeat the pranava mantra, om mantra, or any other mantra that person knows. The Buddhists call pirit or chanting. In Islam, there is this very interesting condition called zikr, where they use a takbir or a kind of necklace for repeating a word like subhanallah, and they keep repeating it. Same thing, very similar technique. The Catholics have a system called rosaries, and they use prayer beads, repeating a phrase, Jesus Christ have mercy on me. Then we also use breathing exercise to bring breathing under control, slow, deep, diaphragmatic, regular, so that the breathing is very calm. Usually when a person, anxious person, they breathe very rapidly, shallowly, using the thoracic muscles. Then various forms of muscular relaxation. Just like Jacobson's muscular relaxation, we can use Shanti-asana or Sabha-asana, body mindfulness, or certain techniques like Tai Chi and so on. Then we can use meditation in various techniques that are known in our part of the world, and also massage can be very relaxing to the muscles if it's done in a proper way using the various oils, the Ayurvedic or Siddha oils and so on. So yoga can be done in a community with a lot of people. It doesn't need to be one-to-one individualized. So you can do it in schools, you can do it in the community with youth or with even elders. So it's a very useful method, and it can be used as a preventive technique, but also therapeutically, person has already developed anxiety. And some of the research we have shown that it's helpful in conditions like asthma, hypertension, diabetes mellitus, mental conditions like PTSD, depression, anxiety, and some research have shown that there's improvement socially. If a certain number of people in the community, over 1% of the community is practicing yoga, there's decrease in various social parameters like crime rates and so on. So finally, looking at the prognosis of anxiety disorder, for acute anxiety, which is caused by some threat or stressful event, the prognosis is good, because once that stress or threat is removed, the person usually recovers, or they learn to cope with it, they adapt to it, they will get better, or they learn some technique like relaxation exercises and so on. Chronic trait anxiety, where the anxiety has been there for years, they are chronic warriors, prognosis is not that good. There's high risk of males particularly taking some drugs, well known is alcohol, to allay the anxiety. So they may become secondarily alcoholic. And also, as I mentioned, many people with anxiety disorder develop depression, maybe because of ongoing anxiety, and it's so distressing, and they find it difficult to get on with life, and they may become depressed secondarily. But we find that both depression and anxiety are very often associated together. Thank you.